I am Debra. I work with Public Health Seattle, King County in the immunization program.
kusoo dhawow warbaahinta bulshada Somali Bridge. Waa maxay walwalka iyo walaaca ka soo kordhay jadeecada?
Yeah, so right now there is a measles outbreak in Ohio, which is really just a plane ride away from here. Over 80 kids have gotten sickened with measles, and of those, over 30 have been hospitalized. And none of those children were fully vaccinated. Some were too young, some just hadn't for other reasons. But you know what? Measles is not only in Ohio, it is all over the world. Every region of the world has experienced a measles outbreak. And a measles outbreak can happen in any place where people are under-vaccinated, including right here in King County. So one of the reasons we worry about measles so much is because it is incredibly contagious. It is actually one of the most contagious diseases that humans have ever faced in the history of humanity. And measles does a couple things that make it really tricky. It can hang out in the air and on surfaces for 2 hours. Additionally, somebody can be sick with measles for several days before they realize that they're infected. So you can see, just how contagious measles is. And we might not worry about it if it was mild, if it was like the common cold. But the reality is that measles is a very serious disease.
Waa maxay calaamadaha lagu garto jadeecada?
So measles starts with a high fever, and then generally includes a runny nose, a cough, red, watery eyes, and some spots inside the cheeks, little white spots. After a few days, you get a rash. It starts on the face and neck, and then goes to the rest of the body. And for most people, measles is a really uncomfortable situation. It's very difficult, but they recover. For some people, it can lead to really serious complications. Things like blindness, pneumonia, which can make it really hard or impossible to breathe, encephalitis, which is a swelling of the brain and can lead to brain damage, and even death. And in recent years, we've come to learn something really interesting and quite awful about measles, which is in some people, it may make their immune system forget how to fight off infections that they've already had. So for example, if a child had chickenpox when they were very young, they afterwards would get immunity to it or protection to it, and they wouldn't get chickenpox again. But if that child goes on then to have measles, it is possible that their immune system could forget how to fight off chickenpox, and then they'd be susceptible or vulnerable to getting it again. Same thing is true for any other infection that they've had earlier. So when we get vaccinated, you're not just protecting yourself from measles, but also from a whole range of other health conditions.
Yay caadi ahaan jadeecadu saamaysaa? Carruurta iyo dadka waaweyn ma ku dhici karaa? Sideese u fidaa?
Measles spreads just like a bunch of other viruses that we're all familiar with, 3 years into this pandemic, coughing, sneezing, and it can live on surfaces. So if you touch a surface that is contaminated and then touch your eyes, nose, mouth, you can get measles if you're not protected. It can live in the air and you can breathe it in. And really, people of any age can get measles. We do worry most, though, about really young kids, so kids under 5, pregnant people, and also people whose bodies may have a harder time fighting off infection because of health conditions. Like, for example, someone who has cancer and is undergoing treatment may have a harder time with measles.
Sidee looga hortagi karaa jadeecada? Haddii aan waalid ahay, ilmahayga ma tallaali karaa?
Vaccination is the single best thing you can do to protect your child from measles. The measles vaccine is called MMR, that stands for measles, mumps, and rubella, because you get protection from all 3 diseases. And to be fully protected, you need 2 doses. So the first dose is usually given to your child around age 1, and the second dose right before they start kindergarten. But if your child did not get vaccinated at those times, it is not too late. You can go and talk to your doctor and get them vaccinated right away. And same is true for you as an adult. If you didn't get the measles vaccine and you've never had measles, now is as good a time as any to go get vaccinated. And there's something I want to make sure everybody understands about measles. So measles is a nasty virus, but it has one thing that is positive, which is that the virus doesn't change. So the same virus that has been circulating for the past, when you and I were children, is still circulating today. And that means that the vaccine can really target that virus and reliably work over many decades. Other viruses work differently, like COVID and flu. Those viruses change a lot. So when you get a vaccine against COVID or flu, you are getting great protection against serious illness, but you might get infected. With measles, not only are you unlikely to get serious complications, but you're unlikely to get infected in the first place, and that protection usually lasts a lifetime.
waxaa jira warar isku xidhaya tallaalka jadeecada, qaamo qashiirka iyo cudurka autismka. Xaggee bay xantaasi ka bilaabatay?
So I have heard those rumors, and this is a myth. Vaccines do not cause autism, but I completely understand why people might be concerned about that, and a lot of it has to do with the history, how those rumors got started. So let's go back 25 years to 1998. There was a doctor named Andrew Wakefield, and he published a paper that said, it tried to claim that there was some link between the MMR vaccine and autism. And we learned really shortly afterwards that his paper was full of lies. It was mostly made up. And really what he was doing was trying to make money. He wanted to create fear and doubt around the MMR vaccine because he was creating his own measles vaccine. He wanted to replace the MMR vaccine. The journal that published his paper, they ended up retracting his study, or basically taking it back, and said that they regretted publishing it in the first place. But in some ways, the damage had been done because this rumor got out there, this myth. Since then, dozens of studies have been done all over the world involving hundreds of thousands of children, and no one has been able to show a link between vaccines and autism, not even Andrew Wakefield. But that has not stopped Andrew Wakefield from trying to scare and intimidate people. He has traveled to Minnesota, where there's a large Somali population, at least twice, to try to spread this myth. Autism, we don't fully understand all the causes of autism. We're learning more and more every day. It's a complex condition, but we do know vaccines do not cause autism.
Sideen u ogaadaa in tallaalka jadeecadu uusan wax dhibaato ah lahayn?
Vaccines are recommended for almost everybody. It's hundreds of millions of people in the United States. So that means they have to be held to the highest safety standards so that they are safe for every person. And before a vaccine is recommended for use, it's first tested for many years. It starts in a lab, and then it's tested with volunteers. Thousands of people volunteer to help answer questions like, does the vaccine work? How many doses do you need? And most importantly, is it safe? Right? And only if we can answer those questions confidently does a vaccine then move on to be recommended. No medical treatment is 100% safe. Everything has a little bit of risk. But with vaccines, that risk is really minimal. If you've had a vaccine before, you probably had a side effect. Maybe you've had a sore arm, maybe you've had a little bit of tiredness afterwards, maybe you even had a low-grade fever. Those are normal. Those are actually signs the vaccine is working. Getting a serious side effect, though, that is really, really rare. And when that happens, we take it very, very seriously. But if you have questions about vaccines, anything, safety, schedule, anything, bring them to your doctor, because that is what they're there for.
Maxaa kale oo ay bulshadaydu u baahan tahay inay ka ogaato tallaalka jadeecada carruurta?
Vaccines protect your child from 14 different diseases by the time they're 5 years old, which I think is just the best gift you can give your child. But, you know, if your child has not gotten all their vaccines on the recommended schedule, it is not too late. So you can just talk to your doctor and get your child caught up so they can be protected.
xaggee ilmahaygu ka heli karaa tallaalka jadeecada? Tallaalka jadeecada iyo tallaalka COVID isku mar ma qaadan karaa?
Yeah, it is perfectly safe to get a COVID vaccine at the same time as other vaccines. And actually, it's a great thing to do so that your child and you are protected from disease as soon as possible. In fact, we recommend giving vaccines together because it is fewer visits to the healthcare provider for you, saves you money, saves you time, and is a little easier for your kid, right? Fewer times they have to go to the doctor and maybe be scared about getting a shot. Now, where can you get vaccinated? Your healthcare provider is a wonderful place to start if you have one. Now, if you don't have a provider, I have a lot of good options I'm excited to tell you about. All CMAR health clinics and most Health Point clinics will vaccinate kids even if you're not a patient. You don't need insurance, so you just call and make an appointment. That's it. Find the clinic nearest you. Another great option are school-based health centers. So these are basically health facilities inside a school. And if you have one in your district, you can enroll your child, and then they can get immunizations for free, they can get healthcare for free, and the best part is you don't need to drive them, you don't need to take time off from work. It's a win-win. Another wonderful option I want to tell you about is a fellow station pharmacy. Now, if you live in Southeast Seattle or you live in South King County, I'm sure you know about them already. They are your neighborhood pharmacy, and they accept walk-in patients. So you don't need to even make an appointment. You just go when it's convenient for you, Monday to Saturday. They speak 6 different languages. And now it's worth knowing they vaccinate adults and kids, but for kids, your child has to be at least 3 years old, and you have to have health insurance. If you don't have health insurance, I encourage you to reach out to the Community Health Access Program. This is a phone service, and they can help you enroll in health insurance and find a doctor, a whole bunch of other services. So you can call them. The number is 1-800-756-5437, or email them chap@kingcounty.gov. That's CHAP@kingcounty.gov. Finally, you can check out the public health website for more information about getting vaccinated. That's www.kingcounty.gov/findaclinic.